Hi friends, let's see about nicotine replacement therapies. What are nicotine replacement therapies? They help people who are in the process of quitting smoking. They provide the person with the drug nicotine that they crave straight into the bloodstream without producing the harmful chemicals. NRT include nicotine gum, patches, lozenges, inhalers, sprays or tablets. Let's see about nicotine gum. Nicotine gum comes in two strengths 2 mg and 4 mg. 2 mg is advised for people less than 18 cigarette usages and 4 mg is advised for people who smokes more than 18 cigars. Treatment duration usually lasts for about 12 weeks, gradually tapering the dose to zero. The disadvantage of nicotine gums are that some people do not like the taste and are not suitable for denture wearers and braces. The advantage is easy usage and easy availability. The next is Nicorette Invisi patches, nothing but nicotine patches. They are placed in the skin in the upper arm and nicotine is released through the skin into the bloodstream. It provides sustained release over 16 hours. Patches comes in 10 mg, 15 mg, 25 mg. Smokers over 10 cigarettes can start with 25 mg. The disadvantage of Nicorette patches are it cannot be used with people with skin conditions and while exercising as they release nicotine more quickly. The next one is lozenges. Lozenges are ideal for people who aren't strongly addicted. When you feel craving coming on, you pop up one under your tongue and it is dissolved. They come in 2 mg and 4 mg lozenges. Smokers of 20 or more cigarettes can use 4 mg lozenges. You can use up to 15 lozenges per day. The treatment duration is usually 12 weeks period, gradually tapering the dose to zero. The next one will be inhalators. The inhalator is ideal for habitual smokers who smoke out of habit, just a breath like a normal cigarette. The inhalator uses 15 mg cartridges which provides 40 minutes of nicotine which can be spread out throughout the day. The next is nasal sprays. These are used by inhaling through the nose. They are of use when craving strikes. They can be used up to twice every hour. This is also normally used over a period of 12 weeks, gradually tapering the dose. These can be sometimes prescribed by a doctor or a pharmacist. The next is a more advanced version, that is the microtabs. The microtabs work by placing the tablet under the tongue. The nicotine is absorbed through the lining of the mouth. Smokers of more than 20 cigarettes should start by taking one tablet every half an hour and lighter smokers every 1 hour. Up to 40 tablets can be taken per day. The treatment duration again for 12 weeks. Zyban and Campix are much more a modern technology that is used in nicotine replacement therapy. It is a non-nicotine version. These are medication taken by people for quitting smoking. They both work by fooling the brain into believing that the body has just had a hit of nicotine when they are both nicotine free. They are usually taken over 9 to 12-week course twice a day. The advantage of this tablet is that they do not contain nicotine, but a disadvantage is that they are used as an antidepressants. So when people come off them, they can become depressed. The next one is e-cigarette, which is most famous modality, but that are not advised by a doctor or a pharmacist. This is in controversy and speculation about their effectiveness. This is mainly because there are no guidelines or restrictions on them at the moment. They are battery operated and produce nicotine or flavored vapor. This is a picture showing the electronic cigarette. The next one we have is a combination therapy, which is a fruitful aid in combining the transdermal patch and the nicotine gums. As we all know, transdermal patch has a tendency to release more nicotine while exercise. We can choose nicotine gums during the time of exercise or a walk or a brisk activity. And then a person when he goes for a work, he can use transdermal patches. The transdermal patch will give a sustained release of nicotine for 16 hours. That's how this combination therapy will be much more helpful. Finally, concluding that recent studies have shown that you are 4 times more likely to succeed in quitting smoking with the help of counseling and nicotine replacement therapies. There are a lot of different kinds of nicotine therapies available to people looking to quit smoking, but some methods just don't work for some people but are great for others. Most of them are available on prescription form from pharmacies and support groups. Thank you, everyone.